Hi. Today let's speak about misconceptions about conception. Misconception number 1. What is the best time to have intercourse so that I could get pregnant? I would advise don't follow this calendar of okay, this is the time that I should try so that I could conceive, because it creates a lot of stress and anxiety both in you and your husband. Instead of that, you could try every alternate day, or it could be once in 2 days, or at least once in 3 days. If you ask me why at least once in 3 days, because the lifespan of an ejaculated sperm is 72 hours, which is equal to 3 days, and this sperm will be alive in the crypts of the cervix, that is the mouth of the uterus. Misconception number 2. When we have intercourse, majority of the seminal fluid comes outside. I think we are not doing it right. Most of the sperms are coming out. This is what is your next doubt. But here you should understand the semen includes sperm and also seminal fluid and other enzymes. It is only the sperms which enter the uterine cavity, then the fallopian tube, which then fertilizes with the egg. Other components of the semen, which is most of it is liquid, has to come out. So 90 to 95% of the seminal volume comes out, only the sperms enter. So it is quite normal for the seminal fluid to come out of the vagina after intercourse. Misconception number 3. What is the best position to have intercourse so that it could optimize the result? There is no such thing called best position. Whichever position the couple is comfortable is good enough to have intercourse. It is just that the semen should get deposited in the vagina. Many of you also ask me about after intercourse, should we keep a pillow or should we raise the pelvis so that the seminal fluid stays inside the vagina? It's not a bad idea to probably keep a pillow, but more than that, immediately after intercourse, don't get up and don't wash the vagina so that it can decrease the probability. So it is not any particular position that you should try, but just make sure the sperms get deposited inside the vagina and it stays there for some time. Misconception number 4. After intercourse and around the time of ovulation, should I avoid exercise? Should I avoid climbing stairs? Should I avoid certain foods? Should I stop traveling? Should I take rest? The answer is don't avoid anything. If at all you have to avoid stress. Stress of whether I'm going to get pregnant or not. Just be normal, chill. Misconception number 5. I tried last month, I didn't conceive. I tried the previous month, I didn't conceive. Is there something seriously wrong with me? For that, you should understand what is normal human fecundity, which means the ability of a human being to achieve pregnancy in one menstrual cycle, which is just 15 to 20%. Which means if 100 couple are planning for a pregnancy, only 15 to 20 would conceive in one menstrual cycle. So if you're trying for pregnancy for more than 1 year, then it could be something abnormal with you that you're not conceiving. But you need not have to wait always for 1 year, especially if you are more than 35, if you have a previous history of surgery on the ovary or on any reproductive organ. You may have to meet the doctor earlier.